Good afternoon, everyone. So we're going to start this session on instruction course on endoscopic vitrectomy. So this session is important in a way because this is not the usual way of doing retinal surgery in our regular retinal practice. There is a different way of visualizing the retina, and this gives us another additional advantage of how to see the retina in cases where you can't. So we have few talks based on what are the instrumentation and different ways of using and different clinical scenarios where we can use the endoscopic vitrectomy. So the first talk is going to be on instrumentation, what are all the instruments which are required where we're going to do an endoscopic vitrectomy. So this is what I was talking about, how we do vitrectomy routinely. So you have a wide angle viewing system or a biome where you actually look at retina while you're doing surgeries. But when you look at these type of cases, not that usually you come across these cases, but yeah, we do come across them quite often. So in these cases, the visualization like what we have seen in the previous slide is not practically possible. In these cases, we tend to remove the cornea and do a temporary keratoprosthesis and look at the retina and do surgery and put the cornea back again, maybe a corneal transplant at that time. So for this, the disadvantage is you need to have a cornea. So if you don't have it, that will be a difficulty in getting the surgery done in these cases. So having said that, what do we need to do an endoscopy? So endoscopy is basically illumination with the camera which goes into the eye, which you'll be able to see the retina using that camera. So it's not a direct visualization like what we do, but you see it on the monitor. So what you are seeing here is a box which is comprises of a camera and an illumination. But there are varieties where you can actually add laser to this. So the one below is where you have a laser machine separately, and when you connect it, this is how it actually looks like. This is an endoscope probe which comes in different sizes. So it comes as a 19 gauge, 20 gauge, 23 gauge. So you will be able to put this endoscope inside the eye using your regular scleral ports, whether you are doing 20 gauge surgery or you doing a 23 gauge surgery. But at this point of time, we still don't have a 25 gauge surgeries. So the limitation is you will not be able to do that if you are used to doing 25 gauge procedure, but yes, 23 gauge is still a sutureless procedure which you can still do it. And the way it works is like this. So this is what usual way of looking at retina, where you have light thrown from the endoilluminator and gets reflected and comes out through the cornea. Whereas endoscopy is where the light is thrown through endoscopic probe, pass through just like an endoilluminator, and the light gets captured and comes out through the same camera. The reason why we have advantage in this is we are bypassing the cornea here. So whatever happens here in the cornea, it doesn't make any difference. You will still be able to see through the camera which you are using. So, and then when you are doing surgery, this is a surgeon and this is the monitor which is there here, where you are able to see the image and do a surgery using that. So the disadvantage of doing this is you have to look at the monitor and do a surgery, and it's a two-dimensional image. Like you said, that you are getting only one camera. And the illumination of this varies sometimes. The image quality goes down as you go down, like the size of the endoilluminator, endoprobe. So the images are better with 19 gauge because of the number of fiber optics which are compacted inside that. And if you go towards a 23 gauge, the image quality goes down because you cannot put so many fiber optics inside that. So the quality of image goes down a little. But that doesn't mean that you cannot do a procedure. You can still be able to do procedure using any of these things. And the advantage of this is you can actually look at the peripheral retina or a ciliary body. So there are curved endoscope probes which can give you access to the angle and the ciliary processes just behind the iris, where you don't have to use a pars plana. So if you are planning to do a glaucoma procedures, you might be able to go through the limbus and actually see what's happening in the ciliary body area, and even do a cyclodestructive procedure with the visualizing the ciliary processes. So that's the advantage. So this is how it is about the instrumentation. So we will go to the next topic of how is it helpful in doing a retinal detachment surgeries. So that's the next thing which we were discussing about. Okay, the retinal detachment, you know, is one of the commonest surgeries which we do in retina. And like I was talking about, these are the retinal surgeries which you can actually do when there is a visualization is good. But how does it help, whether it is endoscope? Is it only in the corneas where it is hazy? I would say no. The visualization in hazy media is definitely, most of the retina surgeons are used to, they're able to manage through the hazy media many times. But the most difficult part which most of us face is looking at the peripheral retina and vitreous base or an anterior PVRs, because you will not be able to see through the peripheral retina that easily, even in clear media. And if it becomes a hazy, then it becomes even more difficult. So we looked at a possibility of visualization in hazy media. It definitely helps in identifying a peripheral problem. So this is a case where we had a corneal haze and we could not see through, and used an endoscope to see what's happening here is a peripheral retina with a hole which is formed there. Sometimes ultrasounds might not pick up these things. Looking at the vitreous base, if you look at it, so see how you are able to see the vitreous here better than what you usually see in case of a regular visualization. This is an advantage because you are looking at vitreous at a different angle. So if when you were used to doing retinal surgeries, if you change your light pipe direction, you are able to see the vitreous little more clear. So that's the advantage which you get while doing an endoscopic vitrectomy. It might appear that you are able to see more vitreous, but it's not more vitreous, but able to visualize that better. And if we see here, the vitreous base is seen, and you can shave the vitreous base more complete using a endoscopic vitrectomy. So that's the advantage, and this has definitely helped us in improving retinal surgery, even in clear media many times. And anterior PVR, so this is a case of an anterior PVR where you can see the retina is pulled up here, stuck to the ciliary process. So this view using an endoscope is not going to be easy while we are doing a regular retinal surgery, even in the clear media. So you can actually go there and dissect it out. But the disadvantage here is you have to do it using one hand, but you don't have an option of doing a bimanual surgery in these cases, because the endoscope will be fixed in your one hand, so you don't have an option of keeping it like a chandelier which we use, and use the two hands to dissect that membranes. So that's a disadvantage, but then the visualization is definitely an advantageous thing in this. The other cases is something like a microcornea. So if you look at this 3 millimeter microcornea, so when we look at this using biome, if you see the distance between the limbus and this ports is same, but from the center of cornea to this, the ports is going to be less. So whenever you put a lens or a biome, you may be able to see the central portion well, but if you want to rotate or you want to move anything to see the periphery, So this is the case where we had a nucleus drop and there is a peripheral retinal detachment. So when it's in the center, you'll be able to see. The moment you try to see, why is it, the image is going out of the view? Because the lens gets moved. So you can't see that periphery. So that's when we shifted to an endoscope, and then that problem will not be there. You are actually able to see the thing pretty well, and you don't have a difficulty in seeing what you are cutting, and then you will be able to do a better surgery. And this case, when you see here, these are the membranes which are there in the periphery, which were able to dissect well using an endoscope. So that's the advantage of using an endoscope, especially in this small corneas. So the pearls in doing endoscopic vitrectomy, this definitely takes a little longer learning curve, but at the same time, the lack of stereopsis is not helping us anyway. But when we look at the things which we cannot see usually, and we are able to see them better, would help us do a better job than what we would have done with the regular visualization. So that's in short about how we do it in a retinal detachment surgery. I'll call upon Dr. Puneet Gupta, who is going to talk about how do you use in trauma, and he'll show a few case scenarios where you can actually see how does it help in doing trauma.